Hello and welcome. You're watching Coronavirus Facts versus Myths. I'm Gargi Rawat. Let's first get you the COVID data. In India logged 27,254 new cases in 24 hours, which is 4.6% lower than the previous day's cases, which was 28,591. The country also reported 219 deaths during that period. Now, the test positivity rate, that's the number of positive cases identified per 100, stood at 2.26%, which is less than 3% for the last 14 days. At 20,240, Kerala leads the state with most number of daily cases. So, out of the 27,254 cases, Kerala alone reporting 20,240 cases. The state also reported 67 COVID deaths, and Maharashtra, which is the worst hit state in terms of the overall COVID cases, reported just 5 new cases in a day. It also reported 46 deaths. And so far, 74.38 crore vaccine doses have been administered under the nationwide vaccination drive. Now, in a very important move, the government informed the Supreme Court that they have come out with guidelines for issuing an official document for COVID-related deaths. This is after the Supreme Court judgment directing the centre to consider expanding the scope of COVID deaths to such people who were admitted initially for the viral disease but subsequently died due to related complications. The death certificates of those who died at home or at hospital within 30 days of testing positive for COVID, and people who continue to be treated for the infectious disease at hospitals beyond 30 days but died subsequently will show the cause of their fatality as COVID, is what the centre has said. So, very welcome move there, and those guidelines have been issued. To talk more about this, we're joined by Dr. Sunila Garg. We're joined also by Anand Bhan, researcher in bioethics, global health and policy. And we're also joined by Dr. Ravindra Mehta, Chief of Critical Care Pulmonologist, Apollo Hospital, Bengaluru. Thank you so much both for joining us. And Anand Bhan, first to you, a very welcome move that finally the government has come out with these guidelines, with these rules. Tell us, how will people now, go back and try and apply for the COVID death certificate?
Sure, Gargi, thanks for having me. As you were rightly saying, it's a welcome move. It's unfortunate that it took the court's intervention for this to happen, but at least now we have a procedure in place. These guidelines have been announced, though quite frankly, they're a bit difficult to find right now. I tried doing a search earlier today on both the ministry's website and the ICMR's website. I couldn't find them. Maybe they are there, but they're hidden somewhere. So these guidelines, one, of course, need to be disseminated to all stakeholders, which includes district level stakeholders, because they talk about a district level forum where people can appeal, but also hospitals, which is where typically these certifications are given out. Families also need to know what the procedures are in case they would like certificates to be amended, because many of them might have certificates which they are dissatisfied with. And moving forward, I think for hospitals to hence issue certificates following these guidelines, if there are deaths, once you have that certificate, families can avail of compensation. There are government schemes, etc. It also helps with closure so that families know that their loved one perhaps passed away due to COVID and when it was not indicated. So it's really important from multiple perspectives. Now it's for the implementation, which sometimes can be a gap, but hopefully that will also be sorted out soon.
Right, Dr. Mehta, so as we said, this is a welcome move. There have been a lot of questions raised about India's death numbers, and perhaps this will help us get, more clear, more transparent death numbers. But also what happens if the COVID-linked death occurs outside hospital, because that I think will still be something of a challenge to go and change that certificate and actually, prove that it was a COVID-related death.
Well, it's going to be a challenge because for the first time after the pandemic came in, we're actually trying to regiment and dissect the issues and find out what is what out here. Both for, first of all, the purity of the task. Secondly, for how to treat them. Thirdly, obviously, for all the issues which my colleague spoke about of epidemiology, documentation, figuring out where we stand, reimbursement, and so on. Outside reflects what happens in routine medicine too. In other diseases also, it's also challenging to find out if somebody died of a heart attack outside, for example, or there was some other issue which got him and so on. So I think that will ultimately be what we'll be doing for donkeys here, the clinical call. There'll have to be detailed history. We'll have to figure out what was there. Was it just asymptomatic COVID, minimally symptomatic? Was there a pneumonia? There are ways and means. Thanks to the science having advanced and understanding being more profound, I don't think it's impossible. There will be gray areas, but that's medicine in general. Anyway, regimenting it, figuring it out should be much easier, and at least we'll get more with transparent data than the porous data we've been having so far.
Right, Anand Bhan, what would you say on this issue of COVID deaths in India? And, after the second wave especially, there were lots of questions raised. A lot of experts also pointed out that the death numbers that we were saying and also the death numbers that were being projected were very, very different.
Yeah, it's likely that there was an undercounting. I mean, I don't think anyone disagrees with that. Now, what obviously there are differing views about is how much was that variation, and by virtue of having these guidelines, hopefully we will get closer to the truer numbers, but that of course requires transparency to be maintained. So once reassessment is done as per these guidelines, and if any death is now reclassified as a COVID death, then that should add on to our tally, and that should be of course available to all of us to know. It's important for the true picture to be available so that we know from a quantitative perspective how many lives we lost due to COVID and what we have learned from that, so that we are able to better prevent that kind of a loss of life that we saw during the second wave in any future waves, in fact in any future epidemic or pandemic outbreaks.
Right, Dr. Mehta, if you could tell us, what will not be considered a COVID death, because that has also been specified in these new guidelines, and it talks about how deaths that take place because of due to poisoning, suicide, homicide, accidents, etc. So that is also important for them to put in detail over there.
Right. So as my colleague said, we don't have access to what the guidelines have actually outlined for people to follow. But as a clinician, one would go ahead and say that if there were two conditions out there, the patient comes in for condition X, say a stroke or a heart attack or a pneumonia, which is, let's not talk of pneumonia, stroke, heart attack or something else, and a COVID test is done because it's become very easy to do them and they're recommended, and the COVID test, in the opinion of the treating teams, has little to do with the primary condition and is a bystander but not a causative factor for the condition. That has to be clearly mentioned. In such a situation, it's an incidental finding, and if anything happens, say with the stroke or the heart attack, which leads to demise, it is not attributable to COVID as judged by the treating clinician. That's very important because that's ultimately what the science will go by. The grey areas are going to be there. There's nothing black and white in this disease in general, and we'll have plenty of times where we're not sure. There's a little pneumonia out there, and people are going to say there's a component of COVID. Or let's not forget, there's a huge science which tells us that any treatment of any COVID positive patient is worse. Surgeries, outcomes, and so on. So the grey areas will be there, but clearly two categories. One is totally COVID, totally not COVID will exist, which will have to streamline the data, and the grey areas will have to be identified with the clinicians and taken in perspective by data collectors.
All right, and what would this mean for cases of long COVID? I know we can't call every death COVID related, but if you could just tell us, we've understood long COVID a lot better. There's talk also of the damage that COVID does to the heart, and lots of cases or talk of how people suffer heart disease and heart attacks post recovering from COVID.
So long COVID also has two components to it. One is a sort of a bothersome component, aches, pains, and so on, and not allowing people to come back into their normal life, which is, I don't think will be an issue. The problem is going to come with long COVID, where you have organ involvement or new organ involvement. So suddenly I have no heart issues and I'm a 35-year-old and suddenly I die of a heart attack after COVID. Or for that matter, my lungs never recovered from COVID and then I developed an infection. Those are the ones which will have COVID-related outcomes or mortality, which will have to be clarified. But otherwise, I think the distinction should not be too difficult. I don't think we should overdo long COVID in people who have otherwise been okay. Clearly, we need to have the fact that these are defined areas, say heart, lung, and so on, wherever there is no alternative explanation. It seems to be reasonably related to the precedent COVID, and that is endorsed, if not by one, but one or two physicians. And in such a situation, it's possible to make a diagnosis. So I think what I'm trying to tell you is a few technical criteria vetted by science and ultimately judged by the treating doctors with these guidelines, which will help to get us more clarity.
All right, and finally on this issue, Anand Bhan, what will be the procedure for redressal of grievances regarding the death certificates? And now the government has said that there will be 30 days for the redressal of grievances, and hopefully that will be the case on the ground as well.
Yeah, so I think the redressal mechanism, as of what we understand right now, is that there will be a district level committee, and that district committee will have some medical officials. These are for example, the chief medical health officer of the district, an expert clinician, etc., who will be involved. People can make a representation to this committee if they feel that the death of their family member or a loved one was potentially due to COVID but was not classified as a COVID-related death. And then they will go through the due paperwork and then make a decision whether that was indeed the case based on these guidelines. Now, but of course, what is important here is to remember that accessing a district level panel or a committee can be not a very easy procedure, and especially for those who might be living in rural areas. So it might be a good idea potentially to have some kind of a facilitation cell which helps with language, with being able to understand medical terms, with being able to access the committee. It should not become another avenue where families go through emotional trauma. Remember, losing a loved one during the pandemic has meant a lot of emotional upsets for families. We should not have to repeat that at this panel level. So I think hopefully they'll do it in a sensitive manner, and there will be supportive mechanisms put in.
All right. Well, thank you both for joining us on this topic. And we're going to now, focus on the vaccination drive. And to get you the latest data on that, 74.38 crore vaccine doses have been administered so far under the nationwide vaccination drive. According to the Union Ministry of Health and Family Welfare, there are 3 states and as well as 3 union territories where 100% eligible population of 18 years and above has been vaccinated with at least the first dose. All adults in Sikkim, Dadra and Nagar Haveli, Himachal Pradesh, Goa, Ladakh and Lakshadweep have got their first dose at least. Over 40.4% of population has received the first dose in India, and 12.7% of the population has been fully vaccinated. So over 12% fully vaccinated. Dr. Mehta, so very welcome that our vaccination drive is moving in the right direction, though it's still a far way from getting 60% of the adult population fully vaccinated. What are your concerns currently?
So I think to put it in perspective, if you look at the last 9 months, we started slow. We had our hesitations. We probably did not move as fast. But come May onwards, I think we are doing very, very well. On the global scene, we are, I think, the highest vaccinators. There was lovely encouraging news recently that India has vaccinated more than the G7 countries. We're talking UK, US, Canada, Italy, Germany, and Japan. So we're doing very well. Numbers like 1 to 1.28 crores are amazing. So that's what the performance on the ground is. However, there's always a however is that we need to vaccinate much more. The number quoted is 10 million a day to try and hit the target of what we are planning to do by the year end. We need to ramp up more. We have the stocks. We have the motivation. The problem is our massive population in an attempt to hit a higher number. This Delta put a higher number on us. Otherwise, it used to be a good 60, 65. The Delta number has been elevated to around 80. But currently, I think what we're doing is good. We need to ramp up even further. We are on track, and we somehow need to also hope that the virus supports us and these variants don't come in overdrive again. If that doesn't happen, between the current efforts, the ramping up of what is there, the commitment and the aim, we should be able to achieve a reasonable endpoint.
Yeah, I'd just like to share a tweet that was retweeted by the health minister, and this is a BJP tweet in which you spoke about the countries and how we've vaccinated more than some of the countries, and in fact they've shown that we've in Uttar Pradesh the doses given is more than the US. This is in September. Gujarat has given more than Mexico, and Karnataka more than Russia, Madhya Pradesh more than France, Haryana more than Canada. This is talking of percentages there. But Anand Bhan, we were talking about concerns around the vaccination drive. It is continuing rather steadily, and but even so, we still, it's a long way to cover 60, and now, as Dr. Mehta pointed out, 80% of the population, if we talk about the Delta variant. What are your concerns?
Yeah, so first of all, I mean, I'm happy that, we have picked up pace. I think there were concerns a few months ago that, we had very ambitious targets and perhaps not the wherewithal in terms of production capacity. I think we're doing very, very well, which is great. I think this momentum needs to continue. The concerns, of course, will be that we need to maximize our population coverage in the shortest possible time, while ensuring that we are keeping track of any adverse events following immunization, while ensuring that we are keeping trust in these efforts and addressing any misinformation or rumors. And the third important part is while also ensuring that routine immunization does not suffer. Because as we are so aggressively vaccinating for COVID-19, we have to remember that there is a whole cohort of kids, pregnant women, etc., who still need their regular immunization. And it's the same immunizers, essentially, the antenatal midwives, our nurses in our facilities who have to do both of these vaccination drives. So it's important for us to ensure that there is no drop in routine immunization.
And are you seeing, hesitancy like we did in the early days? Is that still a concern, vaccine hesitancy?
I think it's lesser so. I would say that it is probably a concern in some pockets. And quite honestly, this has to be something which is an ongoing conversation, because new rumors will keep coming up. People will raise questions around, is it okay to give this to kids when a vaccine for kids becomes available? Do we need a third dose? Is this vaccine effective against a new variant, etc.? So I think that is an ongoing conversation. I think probably it's less of an issue. Rural uptake has been fairly good across the country, but we need to keep a close watch to address any misinformation.
Right. Dr. Mehta, if we take a look at Kerala right now, it's where we're seeing most of the cases that are currently being reported in the country. India has reported to 27,000, over 27,000 cases. 20,000 have come from Kerala alone, but it's also the state that is reporting the maximum number of vaccinations so far. They vaccinated 67.3% with one dose, 26.5% with both doses. So that's, very interesting, the data coming out of Kerala.
So Kerala's data, I think, reflects an interesting part of the COVID paradigm, the way it jumps. It's like hopscotch it plays. So Kerala probably was the last stop of the hopscotch of COVID in India, where it landed, and we believe that Kerala's the second wave came much later. Also, it was shown also in the first time when it hit the US. The better job you do in trying to keep people away from COVID infection, the more you're likely to have the impact of the later waves. It's a very profound statement. So in such a situation, if you've done a great job, then down the line, if it spreads like crazy, and we're seeing that in New Zealand also, where ultimately there's only so much you can stop. The good part is, what we understand is the hospitalizations and deaths are minimal. Healthcare giving people back their lives despite infection is amazingly good at this point. Two, ultimately, at the same time, vaccination is ramping up, which means down the line, it's going to be a very effective strategy. So we may also see that 6 months later, you find Kerala is again trailing everywhere. God forbid something else comes, because they saw the second wave later, they're vaccinating later, and their infections are later. So I think it's part of a staggered phenomenon. The good news is that despite all the worries, it's not spread to other neighboring states. We have not stopped the vaccination drive, and because we have no option. Our vaccination is imperative. Our ticket out of what is this? And we are trying to lead the country literally, the globe literally, because we have such a colossal task in our hands.
Right. And finally, Anand Bhan, the third wave concerns, they still remain even as we're now going into the festive season. So that's a point of worry.
Yeah, of course, we need to keep a close watch. Listen, I mean, this whole conversation is important. Has the second wave ended? Has it really not ended? Because Kerala and Maharashtra continue to see cases. There are other parts of India where seroprevalence rates are relatively low, which means that there is still a fair bit of susceptibility to infection. But at the heart of it is just being watchful, ensuring high vaccination rates, keeping on testing where required to ensure that we know if there is a spread of infection, if we know there are new variants happening, and then hopefully ensuring that we don't see the rapid rise that we saw in the second wave anywhere in the country, because that is where a major challenge happens when health systems get overwhelmed, both in the public and private sector. If that happens, then it's very difficult to be able to prevent deaths, etc. So we need to ensure whichever way that we prevent that, and the more number of people who get vaccinated, probably less likelihood of any such waves happening.
All right. Well, thank you so much both for joining us on the program and, discussing these very important issues, especially the vaccination drive. Thank you for joining us.